All right, let's get this deep dive started. AI in nursing education, it's huge, right? And you've given me a fascinating stack of research articles covering, well, everything. Virtual patients, AI tutors, using AI to maybe design new vaccines even.
What I find really fascinating is that it's not just about, changing how nurses learn, but it's really about getting them ready for a future where AI is just like baked into every part of healthcare.
Yeah, it's not like AI is going away. One article talked about AI helping to personalize learning, tailoring a study plan for every single student.
Imagine nursing school actually adapting to you and how you learn best instead of the other way around.
No more cramming the night before a test, hopefully. But AI is not just changing textbooks, right? Another article really focused on AI chatbots and these virtual patients. And it's not just for like learning facts. It's for practicing actual nursing skills.
It's true, and these aren't just like static programs, they're interactive. Students can actually practice talking to virtual patients, getting feedback on how they handle, tricky conversations, tough medical situations.
Makes a lot of sense, especially for those early days when you're still figuring everything out. Speaking of figuring things out, one article really caught my eye. It was talking about using virtual reality and augmented reality to train nurses.
I know, it's incredible. These technologies are becoming so immersive. Imagine a student puts on a headset and boom, they're in a virtual hospital room practicing procedures or even responding to a simulated emergency.
It's taking hands-on learning to a whole other level, right? The article focused on mixed reality for rehab nursing, but I could see this being used in, well, tons of specialties.
Absolutely. And what's really fascinating about MR is that it blends the virtual and the real. Students can be in a real environment, but they're interacting with these virtual elements like holographic patients. It bridges that gap between textbook knowledge and, the real world.
Yeah, it's not just about the technical stuff. It's about learning to adapt and problem solve in a setting that feels, well, real. Okay, we have to talk about ChatGPT, right? It's everywhere.
I know, everyone's talking about it, and nursing education is no exception. One of the articles we have really digs into how it could be used. And honestly, it's kind of a mixed bag.
I was thinking the same thing.
There's definitely potential there, personalized learning, quick access to information, but there's also a real risk of students becoming way too reliant on it.
Totally agree. It's like any tool. It's powerful when used correctly, but if you lean on it too much,
Exactly. Like, what happens to critical thinking, if you're just asking ChatGPT for all the answers?
it can't replace that deep understanding that nurses need, so where does it fit in? That's the question.
One area where AI seems really promising is in medical surgical nursing. It's a huge area covering so many conditions and procedures, and AI is like popping up everywhere in training.
One article really focused on making learning more engaging, which I think is key. For example, they talked about AI-powered monitoring systems. So instead of just reading about vital signs in a textbook, students can actually see them changing on a simulated patient in real time.
It really brings that sense of, urgency and real world application into the classroom. And it's not just about monitoring, it's about communication too. The article talked about how AI could help nurses bridge those language barriers.
I mean, imagine a tool that could translate conversations between a nurse and a patient in real time.
That would be amazing, right? It could change everything.
It's such a fundamental part of nursing, building that trust and understanding, and language shouldn't be a barrier to that. Okay, shifting gears a bit, another article dove into the potential for AI to help nurses spot those early warning signs, those subtle things that might indicate a problem.
Absolutely. AI can analyze a ton of patient data, looking for those tiny patterns that might indicate a patient is deteriorating. Think of it like an extra set of expert eyes, always watching, always learning, helping to prevent emergencies.
That brings us to mental health nursing, another area where AI could be, well, transformative. One article talked about AI helping to address the stigma around mental health, making support more accessible.
Right, so many people struggle silently. Imagine AI-powered chatbots that could offer 24/7 support, answering questions, maybe suggesting coping mechanisms, even connecting people to mental health professionals.
That could be a lifeline for someone who's really struggling but maybe isn't ready to reach out for help in a more traditional way. And it's not just reactive. This article also talked about using AI to analyze social media and online activity, to identify people who might be at risk for mental health problems.
It's like an early warning system, right? Using AI to spot those patterns and reach out to people, before they reach a crisis point.
It could revolutionize preventive mental health care, for sure. And it's not just about words either. The research talked about AI analyzing voices, text messages, looking for those subtle cues that a human might miss. It's kind of like AI is becoming this incredible detective.
It really is. It's picking up on those nuances that we might not even be aware of. It's amazing to think about. But let's move on to another area where AI is having a big impact. Child health nursing. It's such a specialized field, often dealing with, well, some very emotionally challenging situations.
Yeah, absolutely. And this article I have right here, it talks about using AI to create these incredibly realistic simulations of pediatric emergencies. Instead of practicing on real children, students can use these AI-powered mannequins that respond just like actual patients.
It's so important to get that experience in a safe environment. These mannequins, they breathe, their vital signs change, they even cry. The realism is incredible. It's a world away from those old static dummies.
I bet. And AI can help with diagnostics, too. Imagine a tool that can analyze medical images, spotting those tiny abnormalities that a human eye might miss, especially all those tiny patients.
Early diagnosis can make all the difference, especially in pediatrics. AI could really help ensure that children are getting the treatment they need as quickly as possible. But it's not all about the high-tech stuff. This article also talked about using AI to support families at home.
Yeah, that really stood out to me, too. It talked about these AI-powered chatbots that could answer parents' questions about medications or symptoms, or maybe even connect them with support groups. It's like having an extra layer of support.
Which can be so crucial, especially when you're dealing with a child with a chronic condition. That constant worry, the endless questions. AI could provide that extra reassurance and guidance that families need. All right, let's move into OBGYN care, another huge area where AI is making a real difference and where the potential is, well, enormous.
I was just going to say that. We have this research article that focuses on how AI is already helping nurses in OBGYN, from boosting efficiency to helping make those really critical decisions. For example, it talked about AI being used to predict the risk of preterm labor.
That's such a big one, right? Preterm birth is a major concern, and being able to identify those women who are at higher risk is crucial for early intervention.
Absolutely. And AI can sift through mountains of data, everything from medical history to genetics, even things like environmental factors, to spot those patterns that might suggest a higher risk. It's almost like having this, superpowered detective working alongside the healthcare team.
I love that analogy. It's so true. And this article also talked about AI's role in monitoring for postpartum hemorrhage. It's a serious complication after childbirth, and again, early detection is key.
And AI can analyze all those bleeding patterns, vital signs, and all those other data points to alert nurses to a potential problem, before it becomes a crisis.
Exactly. It's about leveraging technology to keep patients safe and to prevent those worst-case scenarios. And speaking of prevention, the research highlighted how AI can improve cervical cancer screening. We know regular screenings are so important, and AI can boost the accuracy of Pap smear analysis. It's potentially life-saving.
Absolutely. And it's not just about those critical situations. The article also talked about using AI to help manage menopause symptoms, which can be, well, quite a challenge for many women.
And this is where personalization comes in again. AI can create these tailored recommendations based on a woman's specific symptoms and needs. Not every woman experiences menopause the same way, right?
Right. So one-size-fits-all approach just doesn't work. It's about giving women more control over their health and helping them navigate this transition with the best possible support. I think that's a key theme we keep seeing, right? AI can personalize healthcare in ways we never thought possible.
Totally agree. But it's important to remember that AI has its limitations. Nurses need to be those critical thinkers, understanding what AI can and cannot do.
They can't just blindly follow the algorithm. It's about using AI to enhance their own judgment and expertise, not to replace it. So what are your big takeaways so far? What's really sticking with you about AI's role in all these different nursing specialties?
What I find most exciting is how AI is being used to address some of the biggest challenges in healthcare, those things that keep us up at night. Preterm birth, supporting mental health, detecting diseases early, even potentially helping to develop new vaccines. It's not just about, making things faster or easier. It's about using AI to potentially save lives and to make a real difference for patients.
That's a fantastic point. AI is giving us these incredible tools to create a healthcare system that's more efficient, more effective, and, well, more equitable for everyone. And speaking of equity, that brings us to another area where AI is already making a difference. Community health nursing, which is often overlooked, but it's absolutely vital.
Absolutely. Community health nurses are out there on the front lines promoting well-being, often working with communities that are underserved, really tackling those social determinants of health that have such a huge impact on people's lives.
Right, and AI could be a game changer here. It can help nurses identify those needs, develop those targeted interventions, and just improve access to care for those who need it most. For instance, one article really focused on how AI can supercharge disease monitoring and surveillance in communities. Imagine a system that could analyze data from all these different sources, electronic health records, social media, even environmental sensors, to spot those patterns and identify potential outbreaks.
I know, it's like having this high-tech early warning system that can alert public health officials and nurses to those potential threats, giving them a head start in containing outbreaks and protecting communities. And it's not just about reacting to outbreaks either. This research also talked about using AI to develop, well, new vaccines.
I was just going to say that. I mean, that's mind-blowing.
It is, and we know developing vaccines is a long and complex process, but AI can potentially speed things up by analyzing massive amounts of data, identifying those potential targets for vaccine development, maybe even helping us develop vaccines for diseases that were previously considered, untouchable.
That would be revolutionary, especially as we face these emerging infectious diseases and the growing threat of antibiotic resistance. But AI's potential in community health, it goes way beyond just preventing and controlling disease, right?
Absolutely. This article also talked about how AI can be used to encourage people to adopt healthier behaviors, which is a huge part of community health nursing, working with individuals and communities to make those lifestyle changes, to prevent chronic diseases, to boost overall well-being.
And AI can be a fantastic tool for that. Imagine a personalized app that delivers tailored health information, maybe tracks your progress, offers encouragement, even connects you with resources right there in your community.
It's like having a virtual health coach right there in your pocket. And it could be such a valuable resource, especially for those who are trying to manage chronic conditions or navigate the healthcare system, which can be incredibly confusing. But AI can also be used to monitor the environment, which plays a huge role in community health.
Of course, I mean, think about air quality, water quality, exposure to toxins.
Exactly. Imagine an AI-powered system that can analyze data from environmental sensors, identify those areas with high pollution levels, or maybe even track the spread of environmental hazards and alert community health nurses to those potential risks.
It's about using AI to protect communities and to understand how those environmental factors interact with social determinants of health to create, these really complex webs of disadvantage that contribute to health disparities. AI can help us unravel those connections and develop more effective solutions.
It's powerful stuff. It's about moving beyond just treating the symptoms and really addressing those root causes of health inequity.
It's about using AI to create a more just and equitable world where everyone has the chance to live a healthy and fulfilling life. So as we wrap up this part of our deep dive, what are you thinking about? What's really standing out to you about the potential of AI in community health nursing?
What really excites me is how AI can be used to bridge those gaps and to empower communities. We're talking about reaching underserved populations, breaking down those language barriers, connecting people with resources, and advocating for policies that promote health equity. It's about using AI to make healthcare truly accessible to everyone, regardless of their background or circumstances.
It's a powerful vision, and I think AI has the potential to make it a reality. But it's not going to happen on its own. We need to be very intentional about how we develop and use these technologies.
Absolutely. And we need to make sure that we're involving communities in the process, making sure their voices are heard and their needs are being met.
It's about building a healthcare system that's truly by the people, for the people. AI can be a powerful tool in that effort. But now let's shift our focus to another crucial area, nursing administration and policy. It's an area that often gets overlooked, but it's absolutely essential for understanding how AI is going to shape the future of nursing as a whole.
Absolutely. And we have this great research article that really digs into how AI is being used in nursing administration and policy, and it highlights some key applications, but also some of the challenges.
Let's dive in. The article starts by emphasizing how AI can streamline all those administrative tasks, burst efficiency, and even optimize how resources are allocated in healthcare settings. I mean, imagine if we could automate all those routine tasks that take up so much of a nurse's time.
Right. Think about scheduling appointments, managing patient records, even processing insurance claims. All those things could be done by an AI-powered system, freeing up nurses to spend more time with their patients.
That would be a game changer. And it's not just about automating tasks. This article also talks about how AI can analyze data, identify trends, and help nurse administrators make better decisions.
Exactly. Imagine a system that could analyze patient data to pinpoint areas where care could be improved or maybe track staffing patterns to make sure there are enough nurses available to meet patient needs.
It's about making those data-driven decisions that can boost the quality of care, enhance patient safety, and just make the healthcare system work better overall.
Absolutely. And the article also highlights how AI can actually support the development of nursing policy, which is so important because nurses are the ones on the front lines. Their experience and insights are invaluable for shaping those policy decisions that impact patient care.
It's about making sure that nurses have a seat at the table, that their voices are heard. Imagine an AI-powered system that could analyze all sorts of data, patient records, nurse surveys, research studies, to identify those patterns and trends that could inform the development of, really effective evidence-based policies.
It's about using AI to amplify the voices of nurses, advocate for the profession, and ultimately improve patient care. But, as with anything, there are challenges. The article acknowledges that implementing AI in nursing administration and policy isn't always easy. It requires more than just the technology itself.
Of course, it's about having the right infrastructure, the training, the support to really make it work. The article mentions challenges like data governance, making sure that data is used responsibly, interoperability, making sure that all these different AI systems can actually talk to each other, and of course, workforce preparedness, making sure nurses have the skills to work effectively with these AI-powered tools.
It's about building a culture of innovation and collaboration. It's about giving nurses the tools and the support they need to improve their practice and to advocate for positive change in the healthcare system.
And always remembering that AI isn't a replacement for human judgment and expertise. It's a tool, a powerful one, but it's up to us to use it wisely and ethically. But before we wrap up this part of our discussion, I came across another article, also from the IP Journal of Pediatrics and Nursing Science, that I thought was really thought-provoking. It focuses more broadly on the challenges and opportunities of AI in nursing education, and it has some fantastic insights on how we can navigate this landscape that's changing so rapidly. What do you think? Are you ready to dive into that?
Absolutely, let's hear it. It seems we're barely scratching the surface, and yet there are so many ways AI is already being used in nursing education today. One area that really highlights this is simulation labs.
They're like the ultimate training ground, right? A safe space for nursing students to practice those essential skills, get comfortable before they're actually face-to-face with a real patient.
Exactly, and AI is making those simulations even more realistic and, well, effective.
I was reading about these AI-powered mannequins that can mimic all sorts of conditions. And we're not just talking about basic vital signs here. These things can breathe. They have symptoms that actually change. Some can even talk.
It's true. It creates this incredible level of immersion for the students. They can practice those assessment skills, try different interventions, and, well, even make mistakes and learn from them without putting an actual patient at risk.
And the best part, I think, is that the AI can actually provide personalized feedback during the simulation. So if a student makes the wrong call, the system can flag it, explain why it happened, and then offer suggestions for next time.
It's like having a virtual instructor right there with you, guiding you through the process. It's really helping students develop those critical thinking skills, that ability to assess a situation and make the best decision.
Some labs are even using AI to analyze the students' emotional responses during the simulation. They're using things like facial recognition and sensors to track things like heart rate and other physiological changes.
It's about more than just the technical skills. It's about helping students develop that all-important emotional intelligence, learning to stay calm under pressure, communicate effectively, and build resilience. Those are all essential skills for any nurse.
Absolutely. Okay, so AI-powered mannequins are pretty amazing, but we also have to talk about virtual patients. We touched on them earlier, but I think they deserve a deeper dive.
Definitely. There are these computer-generated simulations of patients, and AI is making them incredibly lifelike. I mean, they can answer questions, they describe their symptoms, react to different treatments, and even have different personalities and emotional states.
One article I read really focused on using AI-powered chatbots as virtual patients, and the results were incredible. Students who practiced with these chatbots showed significant improvement in their communication skills and, well, their overall confidence when interacting with patients.
Which makes sense when you think about it. It's a safe space to practice, No judgment, no real-world consequences. Students can practice asking those difficult questions, dealing with all sorts of different patient responses, and really build those essential interpersonal skills.
And it's not just about communication. These virtual patients can be used to teach about so many different diseases, conditions, treatments. One article described a program that used a virtual patient to help students practice caring for someone with sepsis, which is a very serious condition that requires, well, really quick thinking and precise action. The students could assess the virtual patient, make decisions about treatment, even practice communicating with other healthcare professionals, all within that safe simulated environment.
It's a powerful tool for helping students develop those clinical reasoning skills and prepare for those high-stakes situations where there's really no room for error.
It's like a dress rehearsal for real-life nursing. And it's not just for students either. Virtual patients are also being used to train experienced nurses on new procedures, new technologies, keeping them up to date.
It's a great way to offer ongoing professional development and support those lifelong learning goals. Nurses can learn those new skills, get comfortable with the latest equipment, and refine their techniques, all without having to step away from their patients.
It's like having a personal trainer for your nursing career, always pushing you to be the best you can be. AI is almost becoming this like lifelong learning partner for nurses.
I like that. And speaking of lifelong learning, one area where AI could really revolutionize things is in helping nurses stay up to date with all the latest medical knowledge. I mean, the sheer volume of research and information that's coming out all the time, it's overwhelming.
It's impossible to keep up with it all. Even just within your own specialty, there are always new guidelines, new treatments, new discoveries. It's a constant deluge of information.
Exactly. And that's where AI can really step in. We're starting to see AI-powered platforms being developed that can analyze these huge amounts of medical literature and research. They can sift through all the noise and deliver the key findings, the most relevant information directly to nurses. And they can even tailor that information based on a nurse's specialty or area of practice.
It's like having a personalized research assistant. No more spending hours digging through journals and trying to figure out what's actually important.
Exactly. And these platforms can also do things like suggest specific courses, conferences, other resources that can help nurses deepen their knowledge and really stay ahead of the curve.
It's about making professional development easier and more efficient for nurses. It's about giving them the tools they need to provide the best possible care, no matter how much the field changes.
It's about empowering nurses to be lifelong learners, but it's not just about absorbing information, it's also about using that information to make good decisions in real-life situations.
Which is what nursing is all about. You have to be able to assess patients, interpret all that data, make decisions about treatment, and, constantly adapt your care plans. It's a lot.
It is. And that's where AI can help to develop those critical thinking and decision-making skills. We're seeing all sorts of interactive case studies, simulations, even games, all powered by AI, that really challenge nurses to think critically and make those tough decisions in really complex situations.
I love that idea. It's like a mental workout for nurses, a safe space to practice those problem-solving skills.
Exactly. And the best part is that these AI-powered tools can provide feedback, guidance, and help nurses identify areas where they can improve their decision-making abilities.
It's about fostering that continuous learning mindset and striving for constant improvement, which ultimately benefits patients.
Couldn't agree more. But before we get too carried away with all the exciting possibilities, we have to address the elephant in the room, and that's the ethical considerations surrounding AI.
Yeah, it's not all fun and games. As AI becomes more integrated into nursing education, we need to think really carefully about those potential risks and challenges and make sure we're using this technology responsibly.
One of the biggest concerns is data privacy. A lot of these AI-powered tools collect a lot of data about students' learning patterns, performance, even those emotional responses we were talking about.
And it's absolutely crucial that we're handling this data ethically. Students have to know what's being collected, how it's being used, who has access to it. Transparency and accountability have to be built into this system.
The research really emphasized the importance of informed consent. Students shouldn't be participating in these AI-powered programs without understanding how their data is being used.
And then there's the issue of bias in AI algorithms. We know that AI is only as good as the data it's trained on.
Exactly. So if the data is biased, if it reflects existing inequalities or prejudices, then the AI is just going to perpetuate those biases, and that could lead to really unfair, even harmful outcomes. And this is a huge issue in healthcare where, decisions can have such a big impact on people's lives.
Absolutely. It's not just about the data itself. It's about who's developing these systems. We need more diversity in the field of AI, and we need to make sure those systems are being designed with a focus on equity and inclusivity.
It's about making sure that AI is being used to make healthcare fairer and more equitable for everyone. We can't let it exacerbate existing disparities. We have to be really vigilant about identifying and mitigating bias in AI every step of the way.
Another challenge, and this one really resonated with me, is the potential for over-reliance on AI. It's a fantastic tool, but it shouldn't become a crutch.
I agree. We can't let AI replace those core nursing skills, critical thinking, clinical judgment, intuition. Those are all essential, and we have to make sure nurses continue to develop those skills even as they learn to work with AI.
It's all about finding that balance, using AI to support and enhance our abilities, not to replace them. Recognizing that AI isn't perfect. It can make mistakes, just like humans do.
And nurses need to be able to question AI's recommendations, use their own judgment, and always, always put the patient's well-being first.
It's about that human connection, which is at the heart of nursing, and we can't let technology erode that. There's a concern that AI could lead to, a less personal, even dehumanizing healthcare experience.
It's a valid concern. If nurses are spending all their time interacting with machines and less time interacting with patients, that could have a negative impact. But the research actually offers some really interesting counterpoints to that.
Oh, I'm curious to hear that.
Several of the articles talked about how AI could actually free up nurses' time, giving them more opportunities to be present with their patients, offer emotional support, have those meaningful conversations, really build those therapeutic relationships. relationships.
I like that. So it's about using AI strategically, letting it handle those tasks that machines can do well. Analyzing data, monitoring vital signs, flagging potential problems, and then freeing up nurses to focus on those uniquely human aspects of care.
Exactly. It's about using AI to enhance that human connection, not to replace it. And it's about remembering that technology should serve humanity. It shouldn't be the other way around.
I love that. Technology with a heart. So we've talked about some of those core applications of AI in nursing education, but I'm really curious to explore some of the more futuristic stuff, the things that are just starting to emerge. Are you ready for a glimpse into the future?
Absolutely. I'm all ears. Let's see what's on the horizon. All right, welcome back to the deep dive. We've covered so much ground already, but we're not done yet. Now, let's look ahead to how AI might really shake things up in nursing education, in the years to come.
It feels like we've only scratched the surface. I'm excited to see what the future holds. One area that really fascinates me is personalized learning. I know we touched on it earlier, but this feels like a game changer. AI could completely change how nurses learn.
I totally agree. It just makes sense, right? Instead of that one-size-fits-all approach, we can use AI to create a learning experience that really adapts to each individual student. Imagine AI platforms that can assess your strengths, figure out where you need help, and then design a learning plan just for you.
Like having your own personal tutor available 24/7, guiding you through exactly what you need to know at your own pace. No more feeling lost in a huge lecture hall.
Exactly. No more trying to keep up with everyone else, and the personalization goes even deeper. Some platforms can even adjust the difficulty level as you go. If you're breathing through something, the AI can challenge you with more advanced material. But if you're struggling, it can offer extra support, maybe more explanations, examples, practice exercises.
It's all about helping each student learn as effectively as possible. Okay, but let's talk about something even more futuristic. Virtual reality and augmented reality in nursing education. We talked about virtual patients, but this takes immersive learning to a whole other level.
Oh, yeah, it's a whole different ballgame. It's one thing to read about a procedure or watch a video, but imagine putting on a VR headset and being transported into a virtual hospital room. You could interact with virtual patients, practice those complex skills, even respond to simulated emergencies, all in a totally safe environment.
Wow, that's incredible. It would be like stepping into a real-life training ground, but without any risk to an actual patient. And then there's augmented reality, right? Which overlays digital information onto the real world. I was reading about nursing students using AR glasses that can show a patient's vital signs, their medical history, even anatomical structures, all right there in their field of vision while they're examining the patient.
It's amazing. It's like having X-ray vision. AR could completely change how nurses assess patients and process information.
It's mind-blowing to think about. And these immersive technologies are already showing real results. There was a study that showed that nurses who trained using VR simulations actually performed better in real-life tasks than those who had traditional training. It makes sense, right?
Absolutely. The more engaging and realistic the training, the better the learning.
Okay, one more futuristic thing I have to ask about. AI-powered assessments. So instead of those traditional multiple-choice exams, imagine a test that actually changes as you're taking it, adapting to how well you're doing.
It's a really cool concept. So if you're answering correctly, the test gets harder. But if you're struggling, it gives you easier questions. It's all about making the assessment more personalized and more effective.
Exactly. And AI can be used to create those adaptive tests that really pinpoint what a student knows and where they need help. It's much more informative than just a pass or fail grade.
I think it also helps students feel more confident, because the test is adapting to them. They're not just being thrown into the deep end. Okay, I have to ask about this one. AI-powered educational games for nurses.
Yeah, this one sounds like fun, but it's not just about entertainment, right?
Exactly. Games can make learning more enjoyable, and we all know that when you're enjoying something, you're more likely to learn and retain the information.
It takes the pressure off, makes it less like work.
Absolutely. And AI can make those games even more effective. There was this one game I read about that was designed to train nurses on how to manage patients with heart failure. It simulates a real clinical environment, so the nurses have to make decisions about treatment, monitor the patient, communicate with other healthcare professionals, just like they would in a real hospital.
It sounds so realistic.
It is, and the AI is built right into the game, providing feedback, adjusting the difficulty level, even offering tips along the way.
That's amazing. It's a perfect example of how we can use AI to make learning more engaging without sacrificing any of that important content. It's really exciting stuff.
It really is, but amidst all this excitement, it's crucial to remember something we talked about earlier, those ethical considerations around AI. We have to be really mindful of those.
Absolutely. It's not just about the cool technology. We need to make sure that we're using AI responsibly and ethically, especially when it comes to education.
We have to remember that technology should serve humanity. It shouldn't be the other way around. It's about finding that balance, respecting those human values, and always putting the patient's well-being first.
That's such a great message to end on. Thanks so much for joining me for this deep dive into the world of AI and nursing education. It's been an incredible journey. I hope everyone listening feels as informed and inspired as I do.
It really is an incredible time to be in this profession. AI has the potential to transform nursing, but it's up to all of us to make sure we're using it wisely and ethically.
To create a future where both nurses and patients can thrive. Thanks again for being here.